Hi, I'm Dr. Young, and I'm a facial, plastic, and reconstructive surgeon. I'm double board certified in head and neck surgery, as well as facial, plastics, and reconstructive surgery. And I also am fellowship trained, where I took an extra year to learn all these special techniques. And that's essentially all I do. I concentrate in the face and neck area, and I love doing this. I'm going to talk about resurfacing today, and specifically the use of CO2 lasers to do skin resurfacing to improve your skin. Now, there are other modes that you can do to resurface your skin, including chemical peels as well as dermabrasion. But essentially all those different modalities, it's really simple. Essentially what they do is they take away the top layers of the skin and remove unwanted pigmentation as well as cells that are damaged, to allow the cells deeper within the hair follicles to resurface the skin, to improve a lot of elements in the skin that allow your skin to look better. And essentially all those different modalities do the same thing. They have minor differences between those modalities that can lead to different results. Now, there are many different skin types, and essentially Caucasian people and white people fit into the type 1 and 2 classification, and African Americans fit into the type 5 and 6 classification. Now, this is important because as you get into the darker pigment skin types, you start having to worry about more pigmentation problems, including hypopigmentation, which is less pigmentation in the skin, and hyperpigmentation, which is darker pigmentation after the resurfacing. So those are different things that you need to understand when you do resurfacing, and those are some of the things that I can talk to you about. Understanding laser physics is vitally important to get a good result. You can concentrate certain lasers in certain parts of the spectrum of light to concentrate on removing red pigment and dark pigment. And CO2 resurfacing essentially is highly attracted to water, and essentially takes away anything that it contacts on the skin. So it's really good to remove the top layers of the skin. Now, there are many benefits of CO2 resurfacing, including decreasing wrinkles, superficial and deep wrinkles. You can also decrease your pore size, improve the texture of your skin, as well as improve your any sort of scarring within the skin. And another benefit is that it removes some of the unwanted skin cells that have accumulated a lot of damage within the skin, and it can decrease your chance of cancer, your recurrence of cancer. So there's medical benefits with CO2 resurfacing. Now, in terms of deciding what type of resurfacing you want, you really can choose how much downtime you want. And one thing to realize is the more aggressive you are, the more results you're going to get, essentially. And now, this is another cross-section of the skin to explain the differences between active FX and deep FX. Now, active FX will take away the top layers of the skin, and deep FX is essentially a high-powered version of CO2 resurfacing, where it concentrates the lasers to go deeper to tighten up the skin, and it's really good for tightening up loose skin as well as decreasing scarring. And this is a picture of active FX and deep FX, and you can combine the two to get maximal benefits. Active FX, this is just showing that within a spot size of treatment, you're going to treat certain areas within that spot size, leaving healthy tissue in between to allow you to heal faster, so that you have less risk with CO2 resurfacing. And deep FX is a smaller spot size, and it goes deeper and tightens up the skin. And you can combine the two for less downtime and better results too. This is an example of active FX used in the eye, and you can see that the wrinkles are improved in the upper eyelids and lower eyelids. And she approximately had 3 to 5 days of downtime, and she had really good results in the eyes. Now, you can also use more aggressive approaches to even improve that even more, and I'll show you some of the pictures later on. But this is another picture where she has improved her pigmentation within her skin, as well as some of the wrinkling in her cheek. And this is active FX, and it's the less aggressive form. She probably had 3 to 6 days of downtime, and essentially it could have been done over the weekend and maybe a couple days off, Monday and Tuesday, and she had a great result. And this lady is another example of using active FX in the face. She had an improvement of her pigmentation within her skin, as well as the wrinkles and the lines radiating from the eyes, as well as improvement of some of the wrinkles in her forehead, as well as her cheek. Now, you can choose to be more aggressive with CO2 resurfacing to get even more tightening, but you have to expect a little bit more downtime. This is another lady who had improvement of her pigmentation and some of her fine wrinkling in her skin. And if you did choose to do more of the less aggressive type of resurfacing, you can always do this again. And usually people wait around 3 to 6 months, and usually more at the 6-month range to do another round of resurfacing. And it's really dependent on how much time you have to take off. And if you didn't have a lot of time, you can do more of a less aggressive approach and then do it again. This is one of my patients, and she was really happy with CO2 resurfacing. She essentially said, my skin looks and feels more smooth, the lines around my mouth are gone, I really like how my pigmentation is so improved. And that was a before and after, showing a decrease in the sunspots in her forehead as well as the wrinkles. This is another one of my patients who had improvement in her wrinkles in her forehead as well as in between her eyes, and she had the less aggressive form of CO2 resurfacing and probably had, I believe she had 4 or 5 days of downtime, so she was able to really recuperate fast with pretty significant results. And over time your results are going to get better because the collagen